So, um, you know how you were saying you've been having some problems with your kneecap?
Yeah.
Well, you sent me this research article,
Mm-hmm.
and it's a fascinating deep dive into this thing called patellar instability,
Right.
which most people just call a dislocated kneecap.
Yeah.
So let's get into it.
Okay. Sounds good.
This paper is all about like a new way to measure what's going on in there when your kneecap is,
Up and out of place.
yeah, exactly.
Mm.
So the study is from the 2012 American Journal of Sports Medicine.
Okay.
It's called, and this is a mouthful, tibial tubercle posterior cruciate ligament distance,
Wow.
a new measurement to define the position of the tibial tubercle in patients with patellar dislocation.
Catchy.
I know, right?
But, I mean, really what it boils down to is this new measurement that they're calling the TT-PCL distance.
Okay.
And it's basically like if you're looking at an MRI of your knee, it's the distance between your tibial tubercle.
Which is that bony bump below the kneecap, right?
Exactly.
Yeah.
And your PCL.
And just to remind everyone, that's one of the ligaments in your knee.
Yeah, one of the major ligaments that help stabilize the knee.
Okay, so what's so important about this new measurement? Like, doctors have been using this thing called the TT-TG distance for ages, right?
Right.
To diagnose patellar instability.
Yeah, and so for your listeners who might not be familiar with that measurement,
Yeah.
the TT-TG distance basically tells us how far out of place the kneecap is sitting in relation to the groove it's supposed to track in.
Like a train on its tracks.
Exactly, like if the train's too far off center.
It's going to do right.
Exactly. And so we use that measurement to help assess the risk of the kneecap dislocating or popping out of place.
So the TT-TG measurement is over 20 millimeters. That's like a red flag, right?
Right. It's considered a risk factor for potential dislocations.
But what this research is saying is that maybe we're missing something by just looking at the TT-TG distance.
Yeah, potentially.
Okay, so where does this new TT-PCL measurement come in?
Well, the researchers had this hypothesis that not everyone with a large TT-TG distance actually has a misaligned tibial tubercle.
Interesting.
So maybe the train tracks aren't the problem after all.
Huh. So what else could be going on?
Well, that's what they set out to figure out.
Okay.
So they looked at MRI scans from two groups of people. One group who had experienced at least 2 kneecap dislocations.
Wouch.
I know, right?
Yeah.
And then a control group who had no history of dislocations.
Right.
And they measured both the TT-PCL and the TT-TG distances on all the spans.
Did they have a bunch of doctors doing it to make sure they were accurate?
Oh, yeah, they were super meticulous about it. They actually had 3 different experts.
Really?
An orthopedic surgeon,
Okay.
a radiologist, and a general practitioner.
Wow.
All independently take measurements to ensure accuracy.
That's commitment to good data.
Yeah.
So what did they find?
Well, first off, they found that the average TT-PCL distance was significantly larger in the patients who had dislocations compared to the control group.
Interesting.
Yeah, the average for the patients was 21.9 millimeters,
Okay.
while the control group averaged just 18.4 millimeters.
So that's like a clue that this TT-PCL measurement might be picking up on something important that distinguishes people who are prone to dislocations.
Right. Exactly.
So this is getting interesting, but wait till you hear this.
Okay, tell me.
They found that 43% of the knees with a TT-TG distance over 20 millimeters, remember that's the threshold we consider a risk factor, actually had a totally normal TT-PCL distance.
Wow. So almost half the people who we would consider high risk based on the traditional measurement don't actually have a problem with their tibial tubercle.
That's exactly what it means.
That's huge.
It is, and that's why this research is so potentially impactful. It means that some people might be getting diagnosed and treated based on incomplete information.
It's kind of scary when you think about it.
Yeah, I mean, if the tibial tubercle isn't the issue, then surgically moving it,
Yeah.
which is a fairly common procedure based on the TT-TG measurement alone,
Right.
might not actually be the solution.
That's a real possibility, and it raises some serious questions about how we approach patellar instability. If the TT-PCL is normal but the TT-TG is large, what else could be causing the instability? This research suggests that maybe we need to look beyond just the tibial tubercle and consider other factors as well.
Yeah.
Right?
Makes you think.
It does. It's like we've been looking at this like flat 2-dimensional map of the knee.
Right.
And now suddenly we're starting to see things in 3D.
Yeah, there's so much more to the knee than just where the tibial tubercle sits.
Exactly. It's
Yeah.
this complex system with so many different parts working together.
The bones, the ligaments, the
And
muscles,
even the way your whole leg is aligned,
like all matters,
it
really.
all plays a role in keeping that kneecap tracking smoothly in the groove.
Okay, so let's say someone's having kneecap problems.
Mm.
Maybe it's popped out of place a couple times.
Yeah.
They go to the doctor, get an MRI. How would this new TT-PCL measurement actually change things for them?
Well, in the past, the main focus would have been on that TT-TG distance.
Yeah.
But now with this new information, we also be looking closely at that TT-PCL measurement.
Okay.
And if the TT-PCL is normal, even if the TT-TG is large, it suggests that maybe just moving the tibial tubercle surgically might not be the best solution.
So we might be able to avoid an unnecessary surgery.
Potentially, yes.
Wow, that's huge.
It really is, and it's a great example of why personalized medicine is so important.
Right, because everyone's knee is different.
Exactly. We can't just use a one-size-fits-all approach anymore. We need to look at each patient individually, taking all these factors into account, their anatomy, their symptoms of their overall health.
So in this case, if the TT-PCL is normal but the TT-TG is high, what other things might be causing the instability?
That's where the detective work comes in.
Right.
We got to rule out some other potential issues. For example, the researchers found a correlation between a large TT-TG distance and something called knee joint rotation.
Knee joint rotation.
Yeah, basically it means the tibia, your shin bone, is kind of twisted
Oh.
in relation to the femur, your thigh bone.
So it's not just about the tibial tubercle itself, but how the whole knee joint is sitting.
Exactly. And that rotation can put extra strain on the kneecap, making it more likely to dislocate.
I see.
And then, of course, there's the shape of the trochlear groove itself.
The groove that the kneecap sits in.
Right. If it's too shallow or if it has an unusual shape, it can be harder for the kneecap to track properly.
Like trying to force a square block into a round hole.
Exactly. You got it.
Ouch.
And then we also have to think about the soft tissues.
Like the ligaments and tendons?
Yeah, the ones that support and stabilize the kneecap. If those are weak or stretched out, that can also contribute to instability.
This is where I start to get overwhelmed.
I know, it's a lot, right?
It seems like there's so many things that can go wrong with a knee.
There are.
But I guess that's why it's so important to have a good doctor who knows what they're doing.
Absolutely. Someone who can really look at all the clues and figure out what's going on.
And this new TT-PCL measurement gives them another clue.
Exactly. It's a valuable tool that helps us get a more complete picture.
And the researchers themselves even said we need more research, right?
Oh, absolutely. This is just the beginning.
Yeah, this study was just the first step in exploring this new measurement.
Right. We need more data to confirm that 24 millimeters is really the best cutoff point for a normal TT-PCL distance. It's possible that number might need to be adjusted based on, a person's age or sex or activity level or other factors.
And what about, like long-term outcomes? Does knowing a patient's TT-PCL distance help predict how well they'll respond to treatment?
That's a great question, and it's something that researchers are actively looking into.
Huh.
If we can identify specific TT-PCL patterns that are associated with, better outcomes for certain treatments, it could really change how we approach patellar instability.
So potentially down the road, we could use this measurement not just to diagnose the problem, but to help figure out the best way to treat each individual patient.
Exactly. That's the ultimate goal, personalized evidence-based care.
That gives each patient the best possible chance of a positive outcome.
Right.
So there's still a lot to learn, but this research is really promising.
It is. It's really exciting.
It shows that we're making progress and we're getting a better understanding of how the body works.
Absolutely. It's exciting to think about the potential impact this could have on knee surgery and on all those patients out there who struggle with patellar instability.
It's amazing to think that just, learning about a new measurement could have such a big impact on how we think about knees.
Yeah, it really shows how much we still don't know about the body.
As we're wrapping up this deep dive into the TT-PCL distance, I keep thinking about that 43%.
Oh, yeah.
Yeah, and those patients who we always thought were high risk for a dislocating kneecap.
Right.
But it turns out maybe their tibial tubercle isn't the problem at all.
It really changes things, doesn't it?
If you're listening to this and you've been dealing with kneecap issues, this research should give you some hope.
It definitely opens up some new possibilities.
If you've been told you need surgery,
Yeah.
it's definitely worth getting a second opinion and asking your doctor about this TT-PCL measurement.
Absolutely. You always want to be your own advocate and make sure you have all the information before you make any big decisions about your health.
And this research isn't just about avoiding unnecessary surgeries.
Right.
It's about changing how we think about knee problems in general.
It's about moving away from that one-size-fits-all approach and really embracing personalized medicine.
Recognizing that every knee is different.
Exactly.
Every patient is different.
And we need to treat them that way.
This study really highlights the importance of a good evaluation, looking at the whole picture
Right.
and considering all the factors that could be contributing to the problem.
It's like a puzzle. You know, we need all the pieces to see the full picture.
And as we get more data and do more research, we'll get better and better at solving these puzzles.
Absolutely.
We talked about how the TT-PCL measurement could help us avoid surgery in some cases.
Right.
But it also raises some interesting questions about the PCL itself.
That's a good point.
We've been so focused on the tibial tubercle. What about the other side of the equation?
Exactly. What role does the PCL play in all of this?
What if the PCL's position,
Yeah.
or even how healthy it is actually part of the problem?
That's a great question, and it's something that researchers are starting to look into.
It's a whole new avenue of research.
Yeah.
And it just shows you there's always more to learn.
The human body is fascinating.
Well, on that note, we're going to wrap things up here.
Okay.
We hope this deep dive into the world of knees has been helpful.
Yeah.
And maybe even giving you a little more knowledge about how to keep your knees healthy.
Knowledge is power, right?
Exactly. The more you know about your body, the better equipped you are to make good decisions about your health.
Couldn't have said it better myself.
Thanks for joining us, and keep those knees strong.